Welcome to our virtual discussion about infant growth and development. We are from the University of the Cordilleras, from the Bachelor of Science in Nursing, second year, Section E, Group 1. The lecturers are Bukasan Kate Ann, Buenconsejo Jerome, Claude Junessa, Compal Daphne Dale, Navalta Venus Universe, Nieva Renzel, Raimundo Rina, and Rodas Evelyn Edlin Joy. This is a requirement for our NCM 107 Maternal and Child Nursing under the supervision of Ma'am Julie Padilla. Thank you for viewing.
Okay, so these are the stages of growth and development. And for 1 to 4 months old, okay, so developmental milestones, a baby will become much more active and alert and learn to interact with the world around them. So in first month, it may seem that the baby is simply an eating, pooping, and sleeping machine at this point. But a lot is going on in that tiny body, and milestone to watch for include bringing hands and fists toward mouth, though not always with great accuracy, developing reflexes, which is flinching at loud sounds, shutting eyes at bright lights, and focusing on objects brought within 12 feet of their face, and turning toward familiar sounds and voices. And for second month, the baby is starting to act more baby-like, and by the end of 2 months, your baby is likely to be gurgling, cooing, and trying to follow movement with their eyes, called tracking. And although it may seem very coordinated, then holding their head up and pushing upward their hands while laying on their tummy. And for third month, the baby is progressing from dependent newborn to more independent baby. So if the baby verbalizes like, yay, then you might find those 5 minutes to take a shower. Then this is when some of that cuteness overload starts to kick in. So watch for smiling at the sound of your voice, holding their head and chest up and kicking their legs when lying on their stomach, and grasping toys, putting their hand in their mouth with more precision, making more vowel sounds like ooh and ah, something like that, and recognizing familiar faces and objects from a distance. And lastly is trying to imitate your facial expressions. And lastly is the fourth month. So at this stage, the baby is taking the milestones already achieved and perfecting them. So like for example, they may hold their head up more consistently and for longer periods, grasp toys with more coordination, and copy your expressions with more accuracy. So other milestones are holding a rattle and shaking it at the same time, perhaps starting to roll from tummy to back, and tracking movement more fluidly, pushing down on legs when held in standing position. So, your growing baby, by 4 months old, most babies have hit a pretty significant physical milestone by like doubting their birth weight. So on average, the little one will weigh at least 13 pounds or more by 4 months old, although every baby is different. So if the baby was born prematurely, for instance, they may need a little more time to double their birth weight. Okay, so for now, this is the promotion of health, which is reducing the preterm birth. So the earlier an infant is born, the more likely they are to need intensive care and long hospital stay. So with higher medical costs, premature infants are also more likely to have a lifelong health problems like cerebral palsy, developmental delays, chronic lung disease, and vision problem. So this will help the mothers by this preventing and controlling chronic conditions, helping the mother who smoke to quit, and improving their medical care and preventing teen and unintended pregnancy. So the second one is supporting breastfeeding. Okay, so breastfeeding is the best method for early infant feeding and the healthiest option for most mothers and infants. Infants who are breastfed have reduced risk of ear and respiratory infections, asthma, sudden infant death syndrome, and obesity. So, hospital practices in the first hours and days after birth make the difference in whether and how long infants are breastfed. So, according to Centers for Disease Control and Prevention or CDC works with partners to help hospitals nationwide improve maternity care practices that support breastfeeding. And lastly, making home environments safer. So two of the most important ways that parents can make their homes healthy and safe for their infant are to make sure no one smokes in the home and that the infant has safe sleep environment. So to keep the infant safe while sleeping at night during naps, parents and caregiver should place infants on their back at all sleep times, including naps and nighttime, and not allow infants to share their bed. Then use a firm surface such as a mattress in a safety-approved curved center icon covered by a fitted sheet. And lastly, remove all soft objects such as pillows or loose bedding in the sleep area. And that would be all.
Next, we move on to 5 to 6 months of growth and development of a baby. This 5 to 6 months of your baby's life is a time of transition for both of you and your child. Most doctors and experts measure a baby's milestone between 5 to 6 months, so your baby will reach a wide range of physical, developmental, and cognitive milestones during this time. Here's what to expect during 5 to 6 months. Developmental milestones. Keep in mind that your baby at 5 months old may just be starting to hit some of the following milestones or may have already passed them. Babies all develop at different stages, and if your baby was born prematurely or has any special needs, they may be on a different timeline. Here are some of the developmental milestones you can look for this month. We begin with the body. The baby can then roll over from front to back, sit with support. Your baby may even start pushing up to a sitting position on their own later this month. Bears weight on legs, reaches for and holds a rattle, holds up head and chest on their own, pushes to elbows from stomach, actively attempts to reach objects that they spot, follow objects with eyes, and choose on their hands. The next is the brain. So the cause and effect. Your baby is learning that actions such as dropping food off high chair or kicking their legs can cause a reaction. Your baby might enjoy those reactions so much they will repeat them over and over again. Object permanence. Between 5 to 6 months, your baby will discover that objects don't permanently disappear when they are out of sight. This might also mean your little one will cry when you leave the room. Better eyesight. Your baby's eyesight won't be 20/20 until they reach 6 months of age or more, but every week brings an increased clarity of vision for them. Smiles a lot at people and recognizes smiling or frowning. Enjoys playing. Mimics facial expressions such as smiling or frowning. Babbles and tries to mimic language. Cries in different ways, including a hungry cry, a bored or frustrated cry, and a sleepy cry. And responds to affection with a smile. So what else can a 5 to 6 month old baby do? This age is very social and babies start moving in much more purposeful ways. Babies may progress at different rates, but there are some of the common milestones your baby may reach in this age. So these are grasp, moro, root, and tonic neck reflexes. Reflexes normally present in young infants disappear. Balances head well, sits with support, back is rounded, rolls from back to front and front to back by 6 months, grabs feet and toes when lying on back, makes swimming motions with arms and legs when placed on abdomen, and that's it. We have to keep in mind that there's so much going on in baby's development at 5 to 6 months. You might see new emotions, stranger anxiety, babbling, hand and body movements, and much more. Babies can start eating solid food around now if they show signs that they're ready. Simple activities like talking and listening, singing and reading help your baby's learning and development. Speak with your GP or child and family health nurse if you're concerned about baby development or you need support.
So let's move on to 7 to 8 months old infant. How much will a baby grow? While all babies may grow at a different rate, the following is the average for boys and girls 7 to 8 months of age. Weight. Average gain of 1 pound each month. Boys usually weigh about half a pound more than girls, and 2 times the birth weight by 4 to 5 months and 3 times the birth weight by 1 year. Height, average growth of about 1/2 an inch each month, and the head size, average growth of about 1/4 an inch each month. Next, growth and development. They roll over easily from front to back and back to front. They sit leaning forward on hands at first, but eventually they can do it without any support. Bounces when supported to stand, gets on hands and feet and rocks back and forth. May creep, scoot, crawl, backward first then forward. Begins to pull up to stand, reaches for and grasps objects using their whole hand. They bang toys on the table. They can handle an object in each hand, and they may hold a bottle. Plays peekaboo, grabs object with thumb and finger by 8 to 9 months. The teething begins usually starting with the 2 center front teeth in the lower jaw and then the 2 center front teeth in the upper jaw. They learn to drink from a cup and they put everything into the mouth. Naps are usually twice, sometimes 3 times a day for 1 to 2 hours each, which is an average. May begin to awaken during the night and cry. Next, communication and sensory milestones. Babies make 2-syllable sounds like mama and dada. Make several different vowel sounds, especially O and U. Repeats tones or sounds made by others. They also respond to their own names. They appear to understand some words like eat and shows interest and dislike of foods. They enjoy seeing themselves in the mirror. Response to changes in emotions of others. They are afraid of strangers and they prefer their mother over others. They make attention-getting sounds such as a cough or a snort. May follow one-step commands with a sign to demonstrate. For example, telling the baby to get the ball by pointing at the ball. Can start to learn basic sign language to communicate. And that's all for the 7 to 8 months old infant. Next.
So this is the growth and development of the 9 to 12 months old babies. So next. So 9 to 12 months old babies are learning a lot and showing interest in their surroundings. Doctors use certain milestones to tell if a baby is developing as expected. There is a wide range of what is considered normal, so some babies can gain skills earlier or later than others. So how much will 9 to 12-month-old baby grow? So in their weight, the average gain of about 13 ounces each month. Birth weight is doubled at approximately 4 to 5 months and tripled at 1 year. In their height, the average growth of just over 1/2 inch at 1/2 inch each month, with most infants growing 10 inches in the first year. So the head size or the circumference average growth of about 1/2 each month. So what can a 9 to 12-month-old baby do at this age? As your baby continues to grow, you will notice new and exciting abilities that develop while babies may progress at different rates. The following are some of the common milestones your child may reach in this age group. First is they can pull up to a standing position, begin steps toward walking alone. They can start to sit alone, and many others. So what can a 9 to 12-month-old baby say? Speech development is very exciting for parents as they watch their babies become social beings that can interact with others. While every baby develops speech at his or her own rate, the following are some of the common milestones in this age or group. They can imitate sounds and some speech, like saying mama, dada, and they know who they are. They know who is mama and who is dada. So they may also say things like uh-oh or any sounds that they can imitate and can hear. That's also next.
So next we have, what does 9 to 12-month-old baby understand? So babies at this age become much more aware of others and themselves. So they are not yet confident that their parent will return when they leave. So some common milestones children may reach in this age group are follows one-step command with the parent having to show the child how to do it. They may begin to pretend simple activities such as cleaning or drinking from cup, and etc. Next is how does 9 to 12-month-old baby interact with others? So babies at this age have a better understanding for their relationship with others, such as when they are near or far, coming or going. While every child's personality is unique, some of the common behavioral traits your child may show including fear and anxiety of strangers, may cling and clutch parents. They also cry when parent leaves, and etc. Next is, how can 9 to 12-month-old baby learn new skills? So we need to read stories to the babies, to our babies every day. So when your baby asks for something by pointing, we should name the object as you give it to them. Also, we give your baby finger foods and help them to use a spoon, but always remember that allow your baby to do it alone. So do not worry if your baby makes a mess. So as experimentation is important for development. Lastly is respond to your baby if he or she awakens and cries at night, but avoid turning on the light or picking up or holding your baby. So limit your interaction to soothing talk and patting, so telling your babies it is time for sleep. Thank you.
So in relation to the topics that was discussed by my group mates, let us now move on to explore the different theories of development in infants. So let's begin with Sigmund Freud's psychosexual development theory, wherein he stated that at the age of 0 to 12 months old, this is the oral stage wherein the baby experiences the world through their mouth, and stimulation of the mouth produces pleasure. And according to Sigmund Freud, too much or too little oral gratification can result to oral fixation or oral personality, such as nail biting, thumb sucking, overeating, smoking, or even oral aggression. Now, here comes Erik Erikson's psychosocial development theory, wherein he stated that at birth until 18 months is the first stage wherein there is a conflict between trust versus mistrust. So, it is very essential at this stage for the primary caregivers and the parents to build trust by giving affection, comfort, and attention, especially attending reliably to the essential needs of the baby, which is nutrition or food. Success to this will be able to produce an outcome of hope, but failure to do so is going to develop mistrust that can cause the child to become fearful, anxious, and confused. Now, according to Piaget's theory of cognitive development, wherein it was categorized that from birth to age 2 is the sensory motor stage, wherein the baby begins to develop reflexes, habits, hand-eye coordination, object permanence, wherein this is the knowledge of something existing even without seeing it. This is also the phase of experimentation and creativity, wherein the child is acting basing on trial and errors or cause and effects. So Piaget referred to the children at this phase as the little scientists. Now, let's discuss Lawrence Kohlberg's moral development theory, wherein he stated that from infancy to 9 years of age is under the obedience and punishment orientation, wherein the child has a desire to obey rules and to avoid punishment. And lastly is James Fowler's faith development theory, wherein he stated that from birth to 2 years old is stage 0 or primal or undifferentiated faith. And it is characterized by an early learning of the safety of their environment. So hope, love, and trust competes with the environmental inconsistencies or threats of abandonment. Let's proceed to the next topic, which is coping with concerns related to normal growth and development. So, we have a nursing responsibility to introduce some coping strategies in order to be aware about the health, development, and safety issues in order to prevent and to respond to problems. And during the first years of development, we have to also determine some ways to help the parents and the baby to cope and to grow. And the first one is to help the child to learn. So how? By reading, watching, talking, and playing, which are all important ways to help with the baby's mind to grow. And next is tummy time. So this happens, or this is ideal at 3 to 4 months old, and wherein we put the baby in their tummy and aiming to do it for 20 to 30 minutes a day. So this could also give the baby plenty time to explore safely and to gain confidence and try to achieve new skills such as crawling, walking, and to grow into a healthy toddler. Now, we really have to consider that babies are so curious, and so we have to set limits. Because at the age of 1 to 12 months, it's really too young for them to understand or know that there are certain ways that they should behave. And so we have to redirect their attention. Example, your infant is playing with a pet dog and he or she is pulling the dog's tail. So what we can do is to get their attention using a toy. So after that, we can now move the dog in a different area. The next concern is about this infant feeding problem. And so with early diagnosis and proper treatment, it can be controlled before they lead to some more serious issues, right? So next is colic. Okay, some babies cry a lot more than others. A baby who cries more than 3 hours a day, more than 3 days a week for at least 3 weeks might have colic. So usually it starts when the baby is at 2 to 5 weeks and 2 to 5 weeks old and ends by the time when the baby is 3 to 4 months old. So colic happens to a lot of newborns, and it isn't really caused about anything that the parent did or did not do. So the good news is colic can be outgrown by babies. The next concern is shaken baby syndrome, or otherwise known as the abusive head trauma. And this is when a child's brain is injured from physical abuse. Most cases happen when a parent or a caregiver shakes the baby out of frustration or anger just because the baby doesn't stop crying. So these injuries can cause permanent brain damage or even death. That is why we have to emphasize that no one should ever shake a baby for any reason. Let's move to the next concern, which is choking. So of course, infant is at the oral stage. That is why babies love to put objects into their mouths. And to keep our babies from choking, we have to be careful about the sizes of the toys that we allow them to play with. Next is we have to watch for everyday items that could be potentially swallowed by our infants, such as coins and other objects. And we also need to be careful as we begin to introduce solid foods to our babies at 6 months old. And it can help by not giving food to our child that are round, firm, such as hot dogs, unless if it was completely chopped into small pieces. It is also advisable to encourage the primary caregivers of infants or the parents to learn about Heimlich maneuver for choking infants or children. Next is diaper rash. So it often occurs in babies who are 9 to 12 months old. And even though diaper rash is it's uncomfortable, normally this is not really a serious case, because usually rashes disappear rashes clear up when the diapers are changed more often, and if they are careful about cleaning the baby's bottom. At the same time, if we apply non-prescription ointments or cream, it can also clear away. Next is teething. So your baby is teething when his or her first teeth breaks through the gums. So your baby may show signs of discomfort from the sore and sensitive gums. So like for example, the baby is fuzzy, irritable, cranky, or the baby is drooling and may have other mild symptoms for a few days before a tooth breaks through the gum. So according to Baby Center, there are 6 ways to soothe a teething baby, and that is to keep these in the fridge and give your baby a chilled teether, pacifier, washcloth, mesh feeder, or even try to give teething biscuits or use your clean pinky finger to rub their gums. Next concern, sibling rivalry. So it may take a few months before an older child shows signs of jealousy towards the new baby. So when your child realizes that the baby is going to stay for long, then strong emotions and behavior problems may soon follow. So we have to take steps to prepare for sibling rivalry, such as helping your older child to adjust by setting time aside for just the two of you, or a moment-to-moment infant timing or infant bonding with the older child and the parents. And this is also the time that we could take it as an opportunity to talk to the child, to the older sibling, about the importance of participating on the daily care for the new baby. And this is also the time that we can encourage the older sibling to participate and have a role in the daily care, such as handing the wet wipes or the diaper during the time when we are going to change the nappy of our new baby. And the last concern is the separation anxiety. So beginning around 6 months of age, your baby begins to feel uneasy when you go away, and starting around 9 to 12 months of age, he or she may cry and react strongly when you leave. So this is called separation anxiety or separation protest. And we can help our babies manage these emotions by making sure that the child is well fed, well rested before you leave. And it may also help distract them if we give them their favorite toy. Right? So we have to reward them before we say bye-bye to these babies.
Next is promoting health during infancy. We have 3 examples. Supporting breastfeeding. It is one of the most effective preventive measures of a mother can take to protect the health of her infant. Next is promoting safe sleep recommendations, and this is from American Academy of Pediatrics and monitoring sudden unexpected infant deaths that may occur when the infant sleeps in an unsafe environment. Educating families about the dangers of secondhand smokers exposure, and helping mothers and other family members to quit smoking. So, promoting strategies to reduce preterm birth delivery before 37 weeks of pregnancy, which can cause lifelong health problems. Next is we have the guidelines in promoting health for infant. We have the nutrition. It starts during the first 6 months of the infant and second 6 months of the infant, starting for the solid foods and the weaning. Next is we have the sleep and activity, which include the typical sleep patterns, typical activity pattern, and the sleep problems. And we have also dental health and the immunization, which includes the Hep B, Hep A during at birth. Next, we have the prevention of injury. Aspiration of foreign objects such as the toy cars and their toys. Suffocation. Motor vehicles, falls, poisoning, burns, drowning. For the suffocation, for infants, make sure that the smoking cessation during pregnancy and recommending safe sleeping practices. And for the poisoning, child-resistant packaging, make sure that the chemical should not be get for the toddlers to prevent any injuries. And for the motor vehicles, clinical counseling to encourage correct use of child restraints. And for the fires and burns, properly installed and maintained smoke detectors. And clinical counseling must also be present to increase smoke detector use. And for the falls, avoiding the use of infant walkers, gates for stairways, releasable window guards or window stops above the first floor.